Hello and welcome. My name is Erwin Steerley. I'm the Executive Director of the Red Cross for the District of Columbia. And I just want to thank you all for being here today and joining us at the DC chapter of the American Red Cross. So when there is an emergency, the Red Cross counts on our local first responders and municipal partners to help us help those in need. This ongoing trusting partnership with DC Fire and EMS allowed the Red Cross to support over 830 district residents in 2023 after local emergencies, things like home fires. And I'm thrilled this new initiative will expand our existing partnership and enable us to save more lives together. And so I'm going to turn this over real quick to DC Fire and EMS Chief John Donnelly for a few words.
Hi, I'm Chief John Donnelly of DC Fire and EMS, and I'd like to tell you a little bit about how we got here. Whole blood transfusions in the field are relatively new. It comes from the military battlefield. But one of the things that's happened recently is we had a patient who went to a hospital that wasn't a trauma center on their own. Simultaneous to that, we were dispatched for the call that help them. And we were rerouted to the hospital where the doctors at the hospital determined the patient needed to go to a trauma center through our units. But they were afraid, or they said, that the patient wouldn't make it unless we administered whole blood during the transport. So EMS Captain Sharon Moulton, over here, Sharon's on this side, led the crew that took the whole blood in conjunction with the medical direction and delivered that to the patient as they transported to the trauma center, and that patient survived. That really creates the impetus for us to show that this works, and it's something we are very excited to be a part of. So we could talk more about that later if you need to, but now I'd like to introduce the mayor.
Thank you, thank you. Thank you, Chief. I want to thank you, Chief Donnelly, and I, of course, want to recognize all the women of DC Fire and EMS, DC's bravest, who are out there every single day, serving us, protecting us, and looking after DC residents and visitors. So please give them a round of applause. And I know that the chief and the folks who will speak today know a lot more about this process than I do. But what I do know is that DC Fire and EMS continues to innovate and continues to make sure it has all the tools it needs to serve DC residents. So we are very grateful, and I want to thank Erwin and the DC chapter of the American Red Cross for welcoming us to this beautiful facility in Washington, D.C., and allowing us to focus on the partnership that we will have between DC Fire and EMS and the American Red Cross and George Washington University. As you heard from the chief, right now when a patient is hemorrhaging, our EMS teams work quickly to get the patient to a hospital for a blood transfusion. And this new program will allow our paramedics to deliver blood on site so that they can start life-saving transfusions in the ambulance when they reach the patient. And we call this the whole blood program. And the doctors and phlebotomists will say more. But with this, it's another way of us working together, government with community healthcare partners, to transform our healthcare system. And as the chief likes to say, we are the third largest healthcare provider, a moving hospital, if you will, in the city. So this program joins many other new investments we've made, including our DC Stabilization Center, our new hospital in Ward 8, which will be opening very soon now and is coming out of the ground. If you haven't seen it, please drive by. We also know what it takes for blood transfusions to be successful, and that's donors. And the American Red Cross knows a lot about that. So I encourage everyone who's comfortable doing so to donate blood. And you can come here to the American Red Cross's headquarters any day of the week, or you can go to an upcoming blood drive in Ward 7 at St. Luke's Center on February the 22nd, beginning at 10:30. And any blood that's donated at the Red Cross or at St. Luke's will increase the blood banks supply and could save someone's life. So again, I'm very grateful to the hard work of our team, all of the partners involved today. And after the press conference, we'll get a chance to see the Red Cross, their blood donation center and how it works. And we note that it's named for a great Washingtonian, Dr. Charles Drew. So with that, I want to invite DC Fire and EMS Assistant Medical Director, Dr. David Wittberg, to tell us more.
Thank you, Mayor Bowser, Chief Donnelly, Executive Director Sturley, Dr. Holman, and all of my DC Fire and EMS firefighters, EMTs, paramedics, Engine 32 chiefs, for being here today. My name is David Wittberg, and I proudly serve as the Assistant Medical Director for DC Fire and EMS. I am so proud of the amazing work that our team at DC Fire and EMS has completed to develop a system of care where we bring cutting-edge, time-sensitive, life-saving treatments like blood transfusion to the point of injury, to where we first meet folks when they call 911. DC Fire and EMS is one of the largest healthcare systems in the district. We just heard that from the mayor. Our team, led by Chief Donnelly, recognizes and embraces that EMS clinicians and our department's entire framework is a critical and foundational component of our community's healthcare system. What we do from the moment we arrive until we deliver a patient to the hospital has a very real, very measurable, and profound impact on patient outcomes. So why are we here today? The mortality for patients with traumatic hemorrhagic shock, so injuries associated with major bleeding, is high, over 20%. And there are approximately 30,000 preventable deaths in the United States each year due to traumatic hemorrhage. Death by hemorrhage in many cases can be prevented by EMS bringing life-saving interventions like whole blood transfusion to the patient's side rather than waiting to start these things after arrival to a trauma center with some of our trauma doctors. Reducing death from hemorrhage is an area where we have the potential to make a profoundly positive impact on patient outcomes in the district. In the next few weeks, DC Fire and EMS is going to start carrying whole blood, which you see here on the table, our whole setup, and it'll be strategically deployed throughout all wards. Our goals of this program are, number one, to improve clinical outcomes for patients suffering from hemorrhagic shock. Number two, to not waste any precious blood. And number three, to show the nation that we are a progressive agency constantly looking to improve and expand our delivery of high-end healthcare and life-saving interventions to every patient in every corner of the District of Columbia. My daughter Maya is a senior in high school, and she recently donated blood at an American Red Cross blood drive for the first time. And the other night at dinner, she showed me her phone, and it had the American Red Cross app on it. And for those of you who've donated blood, you know about this. For those of you who have not donated blood, please do this. The app is amazing, and it shows where you've donated. It shows when your blood is being processed, tested, stored. And the very last item that they share with you is a notification where your blood was actually used. And she showed me the screen, and she was very proud. We were eating sushi, and it said, "You've helped save more than one life." And below it, it indicated the very precise hospital in which a patient was transfused with her blood. And she was so proud of herself. I'm so proud of her. She's a senior in high school, and it was her first time donating. I am proud of anyone in this room or anybody in the district that donates blood, because it will truly make a difference for this program and for patients all around the region. We all have the opportunity to help each other. This exciting initiative is as much about our paramedics practicing cutting-edge pre-hospital care as it is about citizens helping citizens, neighbors helping neighbors. Looking at the numbers, we project that we may have the opportunity to transfuse and positively change outcomes in up to 400 patients per year in the district with this program. DC Fire and EMS works closely with our area hospitals and trauma centers, who I'd like to thank for being here today. We have the two chiefs of trauma from GW University Hospital, Dr. Bob Serrani, and from MedStar Washington Hospital Center, Dr. Christine Trenkium, with me today. They have both been incredibly supportive in making this critical initiative a reality, and when we all work together, our patients have the best outcomes. I also want to recognize Dr. Zio Fernandez, who's the medical director of the GW Blood Bank, who has stepped up along with the entire GW leadership team to help DC Fire and EMS operationalize this project. And lastly, I'd like to thank our DC Fire and EMS whole blood team, Deputy Chief Ryan Elborn and Lieutenant Holly O'Byrne, who were both pivotal in getting this project off the ground long before I came to DC, organizing the training for all of our personnel, and who have devoted so much time and energy over the past few years to improving our EMS system. So I'd just like, if Dr. Serrani, if you wanted to say one or two brief words.
Good morning. Thank you, Dr. Wittberg. Good morning, Mayor Bowser and Chief Donnelly. I'm delighted regarding our alignment with the Washington, D.C. Fire and EMS Department, the American Red Cross, on this historic step forward in the care of injured patients throughout Washington, D.C. The protocol to allow our paramedics to start life-saving blood transfusions as close as possible to the moment of injury is based on the hard lessons learned by our bravest soldiers, sailors, airmen, and Marines on the battlefield. We have learned that the most common cause of preventable death following injury is blood loss. And the sooner we can start repleting the shed blood, the higher the chances the patient will survive. In a major city like Washington, D.C., where traffic determines transport time more than distance, starting transfusion as soon as possible from the moment of injury can literally determine whether or not someone survives. This is in line with guidance from the Committee for Tactical Emergency Casualty Care, many of whose authors are faculty members at the George Washington University, as well as with actual practice in many other major cities throughout the United States. As you can imagine, creating a protocol required significant time, expertise, and cost. And in this regard, I thank the DC government, as well as the administrations of the George Washington University Medical Center, for their forward vision and resolve. The people of Washington, D.C. will realize the benefits of our hard work. Thank you.
I'd like to invite Dr. Christine Trankium, Chief of Trauma from MedStar Washington Hospital Center.
Thank you, Dr. Wittberg. I'm Christine Trankium. I'm the Chief of Trauma at MedStar Washington Hospital Center. As a leader in trauma care in the region, MedStar Trauma is proud to partner with DC Fire and EMS and GW University Hospital in the development of DC Fire EMS's low-titer whole blood program protocol. We believe that the administration of whole blood prior to arrival to any DC trauma center could make a real difference in the outcomes and survival of traumatic injury in the district. We would like to congratulate Mayor Bowser, Chief Donnelly, and the Department of Health on this groundbreaking initiative. MedStar Trauma began our whole blood program in 2022, and the district's new program is a natural extension of that. Our first responders' ability to provide this important and potentially life-saving resource in the field is a game changer for our DC community. MedStar Trauma encourages folks in the district to come together, and one important way we can do this is to donate blood through the American Red Cross. Giving blood is an important way to support each other in the DC community.
So lastly, I'd like to thank Mayor Bowser for supporting not only this initiative, but all the work the brave men and women of DC Fire and EMS do for the residents of the District of Columbia. I'd now like to introduce Dr. Emily Koberly, Divisional Chief Medical Officer of the American Red Cross. We're so pleased that you've joined us today for this special announcement. Thank you.
Good morning. I am so pleased to be here today to celebrate this important partnership between the American Red Cross and DC Fire and EMS to provide early access to blood products for patients who are experiencing a bleeding emergency. During a bleeding emergency, patients lose not just their red blood cells, which are transporting oxygen to their body, they're also losing plasma that contains clotting factors and their platelets, which help their blood to clot. So during a bleeding emergency, when you transfuse whole blood, you're simultaneously giving that patient back red blood cells, plasma, and platelets to replace what they lost. During a bleeding emergency, there also isn't time to test the patient's blood type, wait for that result to come back, and then choose blood that's matched to that patient. So in these cases, we need to use type O blood. Type O red blood cells are known as the universal donor because they can be given to patients of all blood types safely. And for this reason, as the universal donor, type O blood, as you can imagine, is the type of blood that's in the highest demand. And it's often in short supply, including today. On January 8th, the American Red Cross announced an emergency blood shortage, and that persists today. During the new year, it's often a very difficult time to collect blood due to winter storms that may cause cancellations of multiple blood drives. And also, donors may need to reschedule their donation appointments due to seasonal respiratory illnesses like colds and flu. And so, if your blood type is type O, I would like to ask you to come and donate blood, not only to support this important new program, but also to support and ensure that blood is on the shelves to help all patients who are in need. And thanks to the mayor and other speakers who recognize the importance that donors play in this community in supporting this important new program. So if you're type O, we encourage you to donate. If you're not type O, we need your help too. Although the need for type O blood is higher than for other types, there's a constant need for blood and platelet donors of all blood types to help to care for all the patients who need transfusions each day. This includes people who are having surgeries, people who are undergoing treatments for cancer, and people with medical conditions like sickle cell disease who may need frequent transfusions. Some of these patients, especially those who may require chronic transfusion, may need blood that is more closely matched for red blood cell proteins in addition to ABO. And so for this reason, it's critically important that we maintain a diverse blood supply to ensure that every patient is able to receive the right blood product for them when they need it. Every blood and platelet donor has an important role to play in meeting this ongoing need. So I encourage all eligible donors of all blood types to schedule an appointment to donate blood, and you can do this as mentioned earlier through the Red Cross Blood Donor app. You can go online to redcrossblood.org, or you can call 1-800-RED-CROSS. And as Mayor Bowser mentioned, there's an opportunity for the community to donate alongside our DC first responders on February 22nd at St. Luke's Center on East Capitol Street. Space is limited and appointments are highly recommended. And again, you can make those online at redcrossblood.org. And so with that, I will turn it back to Mayor Bowser.
Thank you. Thank you. Let me ask Dr. Wittberg to join me at the podium. I'm not going to attempt to answer your on-topic questions, but we'll take your questions.
You said all wards, but I was told in the initial rollout it'll just be, I think, 4 battalions, 2, 3, 4, and 7. So
Correct.
And I know it's not it's complicated, right? There's a temperature component to blood and whatnot. So can you kind of tell us a little bit about just how it will work, what neighborhoods where we'll first start seeing this being available,
Sure.
and just kind of the logistics of all this stuff that we're seeing over here?
So I think the first part of the answer is what was just stated, is blood is in short supply. O-type blood is also in critical short supply. So it's logistically and completely impractical to put units of blood on every ambulance in every supervisor vehicle. So we have to be very strategic about where we deploy the blood, but we've done it in such a way that although we're putting it in 4 EMS supervisor vehicles, so there's an EMS supervisor for every battalion in our fire department, geographically covering every ward of the district, even though we're putting units on only 4 EMS supervisor vehicles, and also with our battalion chief of EMS who sits in the center of the city, we can, with any of those vehicles and any of those personnel, reach any of the corner of the district for any patient that needs blood. but we have to be smart about it. We looked at the data. We looked at where blood was most likely to be used based on our hemorrhagic shock trauma statistics, and we've deployed blood in those areas. But again, I want to emphasize, particularly with the two folks that sit in the center line of the city, they can rendezvous with our units, they can be dispatched with our units, they can meet our units, and so there's a logistical piece to this, there's a blood supply piece to this, and as you mentioned, this has to be done with a great care. Blood has to be stored in a very, very tight temperature range. So we want to make sure that as we roll this out, we do this really, really well, because the other part of this program is zero waste. And you heard how short the blood supply is. The last thing I want to do is put 15 to 20 units of blood in the district, and then at the expiration date, we haven't used any of those. So I want to ensure that we're actually using blood product, and then we can expand to other units across the district.
Could I follow up maybe with Red Cross about the blood shortage? We've heard a couple of times critical and what. Could you kind of quantify for us how dire, if that's the right word, is the blood shortage? And how does somebody know, other than asking their doctor, what their blood type is if I don't know what my blood type is, so.
Yeah, sure. So for the second part first, you can find out your blood type by donating blood. When you donate, we're going to check your blood type, and then we're going to put that result in the donor app or in a place that you can access it so you can find out. And even if you don't know your blood type, that's okay. We encourage you to come out and donate, and we'll do that testing, and your blood will go to use. As far as the shortage, I think when we're looking at our inventory levels, we're looking at how many days supply we have to support hospital need looking ahead. And so in this case, I think when we're below 3 days supply of inventory, that's when we are sounding the alarm that there's a critical shortage.
And so what would you optimally like to have as far as how many days supply would you like to have?
Yeah, at least 5. It depends on the product type. It kind of gets into, platelets have a very short lifespan. They're only good on the shelf for 5 days. And so that is a little bit more of a volatile inventory compared to red cells that have a longer shelf life, and whole blood has a longer shelf life than platelets as well. So we're really looking at each individual type, and so some products and types may be on shortage when other types have a good inventory. It's not always in perfect alignment. But in this case, we're seeing multiple types, particularly group O, positive and negative, group B, A negative, multiple types that have been in short supply, and in some cases where products are coming in as quickly as we're sending them out to hospitals. So we're grateful to the community because, as I said, we can't support programs like this that are so important without the donors. You're fundamental to success of this program.
Okay, question here?
If I could follow up on some of the questions Mark had, in terms of the clock ticking on these blood units, pardon me, once they're on board an ambulance, for example, are you facing this is only good for X amount of time at this temperature?
Yeah.
How stable are the temperatures once you're on board an ambulance? And then what about staffing? How many people are trained for this right now?
Absolutely. So whole blood right now has an expiration date of 21 days. So from the moment we take receipt of the blood from the American Red Cross via the GW Blood Bank, we have our IT department at DC Fire and EMS is nothing short of phenomenal. Dr. Chief Chenworth, who's sitting with us, and his team developed a dashboard, which is on display here, where we can very, very tightly track every unit of blood in the District of Columbia Fire and EMS by the blood number, something called an ISBT number, the expiration date, and all of that is color-coded with units that just arrived being green, intermediate to expiration yellow, red nearing expiration, and we've created a very smart system and a very sophisticated dashboard that allows us to move units forward to where they're most likely to be used, because again, we don't want to waste any units. To answer the second part of your question, these are in our EMS supervisor vehicles. These are our EMS supervisors that we have a lot of close contact with in the Office of the Medical Director. We do additional training with. We have 7 EMS supervisors on duty at all times across 4 platoons, so we've trained about 28 to 30 EMS supervisors and a couple of their backups, so in total about 40 people, all paramedics to do this procedure.
Yes.
And
And so, for example, what you just said, are the supervisors going to be the one that makes the call on, okay, we need a blood transfusion now? And how often do you think this will be used? For example, the GW doctor who I interviewed in November made that call. So these supervisors are going to make the call now?
Yep. So we have very, very robust evidence-based pre-hospital treatment protocols. We developed a pilot protocol for blood transfusion in the field that has very specific age and what we call hemodynamic parameters, blood pressures, heart rates, and other kind of quick calculations that have to be done by our paramedics when they get on scene. At the end of the day, our EMS supervisors that have completed this training have been designated as our EMS transfusionists. They will be primarily responsible for that procedure. Under the oversight of the medical director's office, myself and Dr. Holman, we will be doing 100% review of every case for at least the first year of this pilot. So that's who's going to be doing the procedure. The EMS supervisor will, of course, once they get on scene, take information from the engine crew that might be there, the other paramedics that might be there. Everything we do is a team effort. Nobody works alone in this department. We all work together to make the best decisions for our patients.
Mayor Bowser?
Yeah.
I understand not just in D.C. but big cities across the country there was an increase during the pandemic in trauma related to gunshot wounds, stabbings. Curious how that plays into this initiative.
Chief.
So I don't think that there's a cause to say just because we've seen, or if we have really seen that increase. Our call volume has increased, but our breakdown of calls continues to be about the same. This is a evolution in medical care for us. We've seen this in some smaller jurisdictions around the District of Columbia and across the country. So we've watched what they've done, we've learned from them, and I think we're ready to bring this high level of care to our patients.
Just to follow up on that, is there anything, what's holding you back at this point from starting the program today? Why is it taking weeks?
I've got a few agreements left to sign, and I've got some due outs to the Department of Health that I'm working on, and in the next few weeks we'll be done and out.
And Chief, are you going to look towards other departments, like you said? I think Loudoun County does it. Are you going to look towards them? What's going right over there, and what you guys
we've already done that, and we will continue to share our information with them and talk to them. San Antonio is another department that's shared a lot of information. So we absolutely don't do this in a vacuum.
Last question for me. This woman that kind of got the ball rolling on this program, was that the first and only for DC Fire and EMS?
Yes, because we're not carrying it yet, so it was the only one so far. We have 1 second. Dr. Wittberg's daughter's here. Would you mind standing up so we...
She's not the one that
not the one, darn
She's
it.
at school.
Never mind. You can tell her she missed out.
She's in school.
Okay, very good. All right. Where are we going now? To the blood center? Any other questions? Nobody's answering? Okay, yes.
I have one on topic, and then if we're going to do off topic, my on topic is for Chief Donnelly. Chief, this kind of brings up the question around staffing for we hear a lot about MPD staffing. Your staff gave me some data on, I think you're down about 18 paramedics right now. How would you just overall characterize the staffing situation for DC FEMS? Are you where you need to be? Are you down? Is it dire? Is it as bad as MPD?
Well, thanks for the question. I think what I'd really like to say is we just had 85 people start on Monday. How about that? And we had 16 people start December 14th, about the middle of December. That brings us to currently we have 37 vacancies in the agency of 2,349 people. So our staffing's pretty good, and we're working through to fill those 37 vacancies. In terms of paramedics, we have more paramedics now in operations than we ever have, but we always want more. So we're working to get a paramedic program. We're sending some people to GW's program. They'll be starting hopefully on February 2nd. I think one of them is here in the audience. Is that right, Mr. Baltimore? There you go. So we're going to grow our own paramedics for the first time in a long time. and get more paramedics that way. Because I think you're seeing that this starts with the BLS provider, it goes through the paramedics, all the way through. It's a system, and we're growing that. So I'm confident where we are, and we have the right people to do these jobs.
Okay, we'll take a couple more before we go down in case. Anything else?
Off
Yes.
topic?
Question?
Yes. In terms of timing and response time, there's been a lot of criticism about units not being sent to the right places, time taken, people spending 10, 15 minutes when dialing 911. Are you concerned about the impact of that? Or you have an incredible system here. Is the same kind of technology and effort being directed to correct those problems?
So I'm not concerned about that. I think what you're hearing are anecdotes that aren't necessarily indicative of all of the performance that's going on. So I think we're in a good spot. I think the communications and the technology is working. We have a new phone call system, a new processing system coming out from the OUC that should help with all of that. So I believe that we're in a good spot. I don't think that's a problem at all.
I asked Deputy Mayor to talk about OUC.
Sure. Just as you heard, and certainly we talk about MPD staffing and fire EMS staffing, our staffing for dispatchers and call takers is critically important. And so we just had a class start at OUC of 20-plus call takers, and we recently actually had legislation that will allow OUC to hire retired MPD and fire and EMS employees to also help us with dispatch. So we have more call takers than we did last year at this time, and continue to have to bring on classes. One of the things that's been extremely beneficial to us that our agencies like fire and EMS and MPD have is a pipeline. And so we've really worked with DCHR to make sure that we always have people in the pipeline. So as we get vacancies, we're able to bring those classes on in an expeditious fashion. So we're doing well with staffing, but just like Chief Donnelly said, we always are looking for and accepting more call takers and dispatchers at OUC.
I should have acknowledged Deputy Mayor Pia and also Dr. Holman, who is the Fire and EMS Medical Director. And I will just say, I was on scene with the chief last week on Marion Barry Jr. Avenue. I had gotten the report of an explosion, and I didn't have all the details other than everyone was safe. And when I arrived and I saw the building, and I saw that it was adjacent to a daycare center, I was reminded of how grateful I am for DC Fire and EMS, their training, their judgment, and always being on the scene when we need them. I am sure that lives were saved that day. Any other questions? Yes. Last question. Yep.
So about yesterday's officer involved, I'm wondering if there's any new information, particularly if you can tell us how many shots were fired, how many times the
I really
victim was-
can't, Mark. As you know, and sadly, a life was lost in that altercation, and that's devastating news for sure. But the police department is following its investigation when there is a use of force, and I really can't say anything about the particulars.
Chief Donnelly, can you tell us anything about the decision not to put an officer in the bus with the
As I
patient?
said, Mark, the use of force is being investigated, and as soon as we're able to give you a report out, we will.
Can you answer in general what the protocol is for voluntary transport?
No. Any other questions? Yes.
Just one quick one on the CVS that closed in Columbia Heights, or the announcement. What's your message to people who say that they're unsafe to go in these stores that are being ransacked or flash mobs or what have you?
I go in stores in the district every single day, and I think it is true, and this is why we advanced in my Act Now legislation related to retail theft. We have to stop treating it, we never did, the police never did, treating it like kids, like, I don't know, just shoplifting a thing or two, because it's having a real impact on the ability for people to get the goods and services that they need. So the law has to be right. The police have to be able to do their jobs, and the prosecutors have to do their jobs. We do have to send the message in our city that stealing anything, anywhere, has consequences. Thank you.
Follow up on the crime legislation.
Yes.
Two questions. Are you satisfied with the speed at which the council is taking this up? It doesn't look like the final vote might not come until March or late February at the soonest. And then at the Committee of the Whole the other day, several council members expressed concern about the same provision, and that was the drug-free zones provision. Is that a provision that you support as it's written now in the law?
I don't believe that it changed from my introduction in the Act Now legislation, and we support it. We support it 100%. But more than that, the people of the District of Columbia support it and expect it, and I expect that it's going to pass in the council. You've heard me say I'd hoped that this legislation would have been passed last year, but this is where we are, and I want to congratulate Councilmember Pinto on working diligently. And I hope that all of the work that she's done results in a unanimous approval of the legislation. All right, thank you, everybody.